Good morning. It's day 3 post-surgery. My face is tight today, but I feel like I haven't gotten out of bed yet, so I feel like it's improving, and I should be switching out of ice mode. So these are my ice packs. So I've been icing the chipmunk cheeks for a couple days, and the heat is coming down. Yesterday was really the hot swollen day, and today I should be able to switch to using warm compresses to get the lymphatics going. I also did a castor oil pack yesterday, so I have the t-shirt on because it's on my kind of residue from it. I did that on my liver and on my small intestine, stomach area to help detoxify. So I'm sure that's helping the process. I don't know what else to report on other than.
How are you feeling?
Not painful.
Wow.
Not painful. Just a little achy. Oh, I've been able to eat. Had some flan last night for dinner. Been having fruit smoothies with ice, and I did eat some just a little bit of scrambled eggs, just to kind of almost not chewing them at all, but got that little bit of that down. And yeah, so I also had some yogurt yesterday too for extra protein. So feeling overall on the mend. I think I need to rest more. I've been out and about a lot with I've been getting the vitamin C drip IVs, 30 grams a day, and it's beautiful here in Costa Rica. So I'm not running around, but I feel like I thought I would be sleeping almost all day, and I haven't been. And today I'll try and rest a little more after my appointments. But yesterday afternoon I did try to lay down more. I needed to lay down more. I went around and around.
And you hung around in this hammock, which was particularly effective.
Yeah, see, it's all a blur. Yes, yesterday when I got home from the doctor's office, I was more tired, and I tried to take a nap, and I was all about the ice packs, and I had ice packs being held to my cheeks from my hammock, which was perfect, because everywhere else I have to literally hold them here with my hands, which is harder to fall asleep. So but I didn't have a hammock in the bedroom last night, but I did manage to get actually a good night's sleep last night for the first time in a couple nights. I didn't sleep the last 2 nights as well. So got some good rest. I only woke up once in the middle of the night, and no pain. I've taken the anti-inflammatory medication from the doctor once a day, and the pain medication that's supposed to be every 8 hours, I think I've only taken 5 pills in 3 days. So I'm trying to take minimal pain medication. I took one last night before bed for sure. Yesterday I was a little more sore, so I think I took 3 yesterday. But hopefully they say the first 5 days are the most intense, and then I can be weaning. And the homeopathic remedies that I have are great. It's just more complicated because you have to not have eaten or drinking anything for at least 10 or 15 minutes before you put them in your mouth. And so it just starts getting a little more complicated as far as your timing if you have too many things you're trying to do. So, but I do have those. Just doing a little video on this some of the alternative things I got that I haven't really done everything with them. A little harder to do all this one-handed. These came in little Faraday bags from Dr. Louisa Williams. She's a naturopath in Texas. These are cell salts that are supposed to help with electrolytes and mineral and recovery, inflammation. These are the drops that are isopathic drops from Germany. They're diluted aspartame and molars. And these are meant to be placed in the mouth on the sockets of the cavitation removals, and then also outside, kind of on the outside of the face and neck and upper back for the nerve ganglion, resetting those things. And then you'll also use the laser on the outside of the cheeks after you do the drops in the mouth to help push those into the tissues, and then you also do that along the head. These are the homeopathic remedies, the arnica and the hypericum, and so both the homeopathics and the isopathics all require a 10-minute waiting period between putting them in your mouth or having any water or food or any other supplement. So I'm just doing this video on day 3 after the surgery, and I've been going to the clinic for a vitamin C infusion, 30 grams, so a high dose vitamin C every day. And that first day I also met with Dr. Fernandez and reviewed the video, and then actually that day I ended up going to another clinic and talking about getting Invisalign so that we can get my bite improved and have room to put my final crowns on. So I'm going to do that with the orthodontist here, and I'll come back in a month and get my trays. And so lots of interesting things, but that first day, I felt great. So I was out and about. So I think Joe helped me do these in the evening once with the laser. These I did a lot more the first day and second day. Yesterday I think I did them only twice. And these I only did once yesterday. So they're great. And especially, I thought that I was going to be in bed, which I know I need to rest more because rest is important for the healing. But I sort of had a delay. I think I was just so exuberant and excited when that infection was out of me. The day after the surgery, I felt like $1,000,000, and I was excited and a little hyper. Didn't even want to go to sleep that night. But day 2, things start kicking in yesterday, more swelling and more the normal thing. And today, like I said, I'm not having any pain. I took a pain med last night before bed, so it's been about 8 hours. And so we'll just see. I just wanted to update you. And so there's a lot of, support that I brought. There's even more than this. But these are just one of the packs of some of the things that I'm trying to work in. But these require a little more planning. So that is the supplements. And then obviously I also have arnica gel putting on my face for the bruising, and I have the laser, this Quinton C plasma. I have some algae supplement. This has lots of minerals and it's detoxifying. And I have this enzyme supplement that also has a little colostrum and olive leaf in it, lactoferrin. So this helps with all of those buggers of bacteria that they they cleaned out the pus, but that had been being pumped through my lymphatic system in my body for God knows how many years. So my body's got to heal and clean that all out of all the rest of my body. And so the enzymes help, the proteolytic enzymes, and they also help to break the cell walls, and so that your body can take those out. I'm sure I'm missing things because there's a lot that I brought down here. I have bone broth. I brought down a NutriBullet blender. I had my normal supplements. Well, no. I had the big boxes of supplements to match what the Swiss Dental pre and post surgery recommendations were for a month before and after. So I have those boxes as well. And I've been working a little bit with the laser with those too, so I'll do another video later with those, but not nearly as much as the protocols have called for, just because we would be sitting here for several hours a day saying, okay, take this supplement, timer for 10 minutes, take this supplement, timer for 10 minutes, do this point, timer for 10 minutes, which we thought I would be doing, but the days have been going more quickly, and but I'm recovering well. So today I go and see the prosthetics doctor and get another IV at the clinic. So hopefully they'll say, yes, this is bruising and the swelling, this is all normal. What they told me yesterday, but I think I was a late bloomer, because that first day I had almost no pain, no swelling, very little, minimal, not much heat. It hit me the night after, and so yesterday they said no, stay with ice. So that's the update. The afternoon on day 3 after the surgery, Friday, February 3rd. Just had my IV, my last antibiotic in it, and mineral vitamin, high dose vitamin C IV, 30 grams of vitamin C, and now I'm going to have a green smoothie before I have my appointment with a prosthetic specialist for my temporary for my front tooth. It's nice here today, but I'm a little tired, but it's just minor pain. I'm not taking any pain medication other than NICO today, and the anti-inflammatory medicine. But more bruising. But the swelling's starting to go down, and today I get to switch to warm compresses if I want to help with the lymphatics, and no more ice, although I may do a technique that is ice for 10 seconds, longer heat for like 30 seconds or a minute, and then ice for 10 seconds to flush and get some of the swelling moving out. But they said so far everything's doing really great, and I'm really happy with everything.